Welcome to the deep dive. Today, we're getting into something really common, but maybe a bit misunderstood, affecting our dog's chronic degenerative valve disease, or CVD. It's all about understanding our dog's hearts, really, and how we keep them thriving.
It really is. Think about your dog's heart like this incredibly efficient pump, right?
Hmm.
Just constantly working. And inside, you've got these critical doors, the valves.
Laos, okay.
Yeah. And their whole job is to make sure blood flows one way, forward, no backing up.
Makes sense.
So CVD, chronic degenerative valve disease, is basically when these doors start to wear out. It happens typically with age.
So it's like aging, not an illness they catch.
Exactly. It's a degenerative thing, not an infection. The valves gradually get thicker, maybe a bit lumpy, and when that happens, they don't seal perfectly shut anymore.
Ah, so you get leaks, like a leaky door.
Precisely. A leaky door effect. Blood flows backward, which technically we call regurgitation.
Regurgitation, okay.
And vets can often hear that. That backflow makes an abnormal sound, a heart murmur, when they listen with a stethoscope. It usually affects the mitral or tricuspid valves, but the mitral valve, that's the one on the left side, that's the one we see affected most often and usually most severely.
That pump and leaky door analogy really helps. So, okay, if that door's leaking,
Right.
our mission for this deep dive is, well, figuring out who's most at risk, what signs, subtle things we should look for at home,
Right.
how vets pin it down, the diagnosis, and really crucially, what can we actually do about it? How do we manage it so our dogs can have the best, longest lives possible with us? Let's unpack this.
Okay. So at its heart, CVD is, like we said, degenerative. Those valves, mostly mitral and tricuspid, they just thicken up, get a bit lumpy over time.
And that stops them closing properly.
Exactly. They can't make a tight seal with each beat. So blood leaks backward, back into the chamber it just left. And that backward flow, that turbulence, is the regurgitation we talked about.
So is that the murmur, that whoosh sound the vet listens for? Is it always obvious?
That's exactly it. The turbulent blood flow, the regurgitation, creates that whooshing sound, the murmur. And it can vary. Sometimes it's really subtle, takes an experienced ear. Other times it's quite loud, very obvious.
And you said it's common.
Oh, incredibly common. CVD accounts for something like 75% of all heart diseases in dogs. It's definitely the most common heart issue we diagnose.
Wow, 75%. That's huge. So who gets it? Are some dogs just more likely?
Yeah, there are pretty clear risk factors. Age is a big one. The risk is way up as dogs get older. It's really, really rare in dogs younger than 4.
Okay, so older dogs primarily.
And size matters too. Small dogs, under about 40 pounds, 20 kilos or so, much more prone than large breeds.
Interesting. And what about breeds? Any specific ones pop up again and again?
Oh, absolutely. We see it a lot in dachshunds, miniature poodles, cocker spaniels, miniature schnauzers, lots of terriers too.
Right.
But the one breed that really stands out, sadly, is the Cavalier King Charles Spaniel.
Ah, yes, I've heard that.
They can get this disease really quite young, sometimes only 2 or 3 years old, which is, much earlier than we typically expect.
That must be so tough for owners, finding out that young.
It is. And one more factor, weight. Being overweight puts extra strain on the heart, increases blood pressure, and definitely bumps up the risk.
Right, keeping them trim is important for so many reasons. So when a vet does diagnose this, you mentioned it progresses. It's not just one thing, it's stages.
That's a really key point.
Yeah.
Yes, we stage it. Vets use guidelines from the American College of Veterinary Internal Medicine, the ACVM, and the stage tells us how advanced it is and, crucially, guides the treatment.
Okay, so what are the stages?
It starts with stage A.
Mhm.
These are dogs that are just considered at risk. Maybe they're a high-risk breed like a Cavalier, but they don't actually have the disease yet. Their heart structure is still normal.
Got it, just at risk. Then stage B.
Stage B is split into B1 and B2. In stage B1, the vet can hear a murmur, so the leak is there. But the heart chambers haven't changed size or shape yet. And importantly, these dogs typically have 0 clinical symptoms. You wouldn't know anything was wrong just by looking at them.
Wow, okay. So hidden. What about B2?
In B2, the murmur might be louder, the leak is worse, and we start to see evidence that the heart is beginning to enlarge. Maybe blood pressure is starting to creep up too. But again, still generally no obvious symptoms the owner would notice day to day.
So it's really hiding for potentially a long time. When do the signs actually start showing up?
That happens in stage C. We call this the symptomatic stage. This is when things become more obvious, and it's often when we talk about congestive heart failure.
Congestive heart failure. That sounds serious.
It means the heart isn't coping well, and fluid starts to build up. Most often in the lungs, that's pulmonary edema, or sometimes in the belly, which is called ascites.
Okay.
At this point, stage C, treatment with medications, often multiple medications, becomes essential to manage those symptoms and help the dog feel better.
And is there a stage after C?
Yes. Stage D, that's when the clinical signs are severe, and unfortunately, they aren't responding well to the standard treatments anymore. It's considered end-stage disease. But well, fascinating isn't quite the right word, maybe critical. What's critical here is how many dogs are asymptomatic in those early stages, B1 and B2. They look fine, act fine.
Right.
Which is exactly why those routine vet checkups, just listening with the stethoscope, are so incredibly important for catching it early.
It really highlights the value of those visits, doesn't it? Okay, so let's say the disease is progressing. What are the actual signs someone might see at home? What should they be watching for?
Breathing changes are often the first big clue. You might notice faster breathing, like more than maybe 30 or 35 breaths a minute when they're just resting or asleep.
Okay, faster breathing.
Yeah, and we actually really encourage people to, count that sometimes. Just watch their chest rise and fall for a minute when they're sleeping, get a baseline.
Tit-tit.
Or you might see labored breathing, like they're really working at it, using their belly muscles to breathe. Coughing or gagging can be another sign, especially if it happens more at night or after lying down. That could be fluid in the lungs, or sometimes the enlarged heart itself pressing on the windpipe.
Okay, breathing issues. What about activity? I guess they'd slow down.
Absolutely. Changes in activity are key. Getting tired really easily is a big one. Like they poop out after just a short walk, much quicker than usual.
Right.
Or just a general decrease in stamina. Less interested in playing, maybe not wanting to go as far on walks.
Yeah.
You might just notice them resting more overall. Less get up and go than they used to have. And in more advanced cases, you could even see fainting spells or sudden weakness because the heart just isn't getting enough blood circulated.
Painting. Wow. Okay. Are there other, maybe less obvious signs?
There can be. Sometimes you might see abdominal swelling, that ascites we mentioned, where fluid builds up and their belly looks bloated or distended. Trouble sleeping is another one. They might seem restless at night, constantly shifting position. Or maybe they prefer to sleep sitting up or kind of in that sphinx pose rather than lying flat out.
That's interesting. Trying to breathe easier, maybe?
Potentially, yes. It really shows how those subtle shifts, just resting more, not greeting you with the same energy, can be telling you something important. Other things could be a decreased appetite, maybe some weight loss you can't explain, or even just seeming a bit down, less interactive.
So if you notice any of that, or you know your dog's a high-risk breed, it sounds like getting to the vet is the next step. What happens there? How do they figure this out for sure?
Absolutely. See your vet. The first step is always auscultation. That's the fancy word for the vet, listening carefully to the heart and lungs with a stethoscope. They're listening for that murmur, assessing its loudness and where it's loudest.
Okay, the listening part first.
If they hear a murmur, then usually more tests are needed. Chest x-rays are really common. They help show the size and shape of the heart, and crucially, check for fluid buildup in or around the lungs.
X-rays. Got it.
But the gold standard really is an echocardiogram. It's an ultrasound of the heart.
Ah, like an echo.
Exactly. It gives detailed moving pictures. You can see the valves working or not working properly, measure the heart chambers, and actually see the blood flowing backward, that regurgitation. It confirms the diagnosis and helps determine the severity.
That sounds pretty definitive.
It is. They might also do blood tests, often to check kidney function because heart disease and some heart medications can affect the kidneys. And measuring blood pressure is also common, checking for high blood pressure or hypertension. Now, connecting this back, it's important for listeners to understand, right now we don't have a way to reverse the damage to the valve itself. We can't make it young again, so to speak.
Right. No cure.
No cure for the underlying degeneration.
Yeah.
So the goal of treatment is really about managing the disease, slowing its progression, controlling the symptoms, and most importantly, maintaining a good quality of life for as long as possible.
Okay, so it's about management. And thankfully, it sounds like there are good ways to do that. Medication is usually key, right? What kinds are used?
Medications are definitely a cornerstone, especially once you reach stage B2 or C. Diuretics are very common drugs like furosemide, sometimes spironolactone. They help the body get rid of excess fluid, which eases congestion in the lungs or abdomen.
Okay, fluid pills, basically?
Essentially, yes. Then there are drugs called positive inotropes. The main one is pimobendan. Maybe you've heard the brand name Vetmidin.
Vetmidin, yeah, I think so.
That drug does two things. It helps the heart muscle contract more strongly, pumping blood more effectively, and it also helps relax blood vessels. And what's really interesting, Studies have shown that starting pimobendan even in stage B2, before they show symptoms, can delay the onset of heart failure and help dogs live longer.
Wow, so starting it early can make a real difference.
It seems so, yes. There are also vasodilators, like enalapril or benazepril. They work mainly by relaxing blood vessels, which lowers blood pressure and reduces the workload on the heart, making it easier for the heart to pump.
So often a combination of these.
Very often, yes, especially in stage C. The vet tailors the plan. But, and this is really crucial, never ever give your dog new medications or supplements without talking to your vet first. Heart medications can interact badly with other things.
That's a super important warning. Definitely check with the vet. What about the things owners can do at home? Lifestyle changes.
Yes, lifestyle plays a big part. Exercise needs moderation. Let the dog set the pace. Avoid really strenuous stuff for long, exhausting outings, especially in hot or very cold weather.
Okay, gentle walks.
Exactly. And weight management is critical. Keeping your dog lean takes a significant load off the heart.
Makes sense. What about food? Any special diets?
Diet can help. Lowering sodium intake is often recommended, especially once fluid retention is a concern, like in stage C. It helps manage that fluid buildup. There are prescription heart diets that are low in sodium.
So low salt.
Low salt, yeah.
Yeah.
Though it's worth noting, for dogs still in the asymptomatic stages, like B1 or B2, restricting sodium hasn't definitively been proven to slow down the valve disease itself. Its main benefit is managing fluid later on.
Okay, good distinction.
Reducing stress is also good. A calm environment helps. And some vets recommend supplements like omega-3 fatty acids, maybe CoQ10. But again, always discuss supplements with your vet before starting them.
Right, vet first.
And if that abdominal fluid, the ascites, gets really bad and makes the dog uncomfortable, sometimes the vet can perform a procedure called paracentesis, basically draining the fluid off with a needle. It provides temporary relief, though the fluid usually comes back. But here's the thing. The part where you, the listener, can make the biggest day-to-day difference. It gets really impactful here, potentially life-saving. Forget all the fancy tests for a second. The single most powerful tool you have at home is counting your dog's breathing rate when they're asleep or resting calmly.
Counting breaths, really?
Absolutely. It's free, takes maybe 30 seconds, and it is the earliest, most sensitive indicator that heart failure might be starting or worsening, often way before you'd notice other subtle signs. It's your personal early warning system.
Wow. Okay, tell us how. What are we looking for?
It's simple. When your dog is deeply asleep or very relaxed, just watch their chest rise and fall. One rise and fall is one breath. Count how many breaths they take in one full minute.
Okay.
A normal resting or sleeping respiratory rate for most dogs is typically between 15 and 30 breaths per minute. Some say even under 25 is ideal.
15 to 30. Got it.
If you consistently find the rate is over 30, or definitely over 35 breaths per minute, or if the breathing looks difficult or labored, that's a red flag. You need to call your vet right away.
Consistently over 30. Call the vet.
Exactly. We recommend doing it daily, maybe even keeping a little log. It gives your vet invaluable information to help manage the condition and adjust medications if needed. It truly empowers you. Now, surgery. For a long time, fixing these valves in dogs, like they do routinely in people, was, well, very difficult. Open heart surgery is high risk, technically demanding, and incredibly expensive for dogs. We're talking maybe up to $50,000 in the U.S., and very few places could even do it.
Yeah, that sounds pretty inaccessible for most.
It was. But things are changing.
Through a catheter. Wow.
Yeah, it's amazing. The benefits are huge. It's much lower risk than open heart surgery. Dogs often feel better almost immediately and can typically go home the next day. And while it's still a significant cost, it's less than traditional surgery, maybe in their $10,000 to $20,000 range. It's offering real hope for repair.
That's incredible. Truly groundbreaking. So putting it all together, the stages, the management, the new surgery options, what does this mean for how long a dog can live with CVD? What's the outlook?
It really depends heavily on the stage, when it's diagnosed, and how it's managed. For dogs get diagnosed in the asymptomatic stages, B1 and B2, the outlook is often quite good. Many can live for years, 1, 3, 5 years, sometimes even longer, without ever developing signs of heart failure.
Years, okay. That's good to hear.
Yeah, some may never even progress to stage C.
Yeah.
But once they do reach stage C, the symptomatic stage, well, the disease will inevitably progress, even with medication. However, with good management, careful monitoring at home, and regular vet checks, many dogs in heart failure can still have a good quality of life for quite some time, often say 1 to 2 years. sometimes longer.
1 to 2 years or more, even with symptoms, if managed well.
Yes, quality of life is the focus then.
Okay, so let's wrap up this deep dive. CVD, chronic degenerative valve disease.
Mhm.
It's super common, especially in our older, smaller dogs. No cure for the valve wear and tear itself right now, but it sounds like it's very manageable.
It is.
Early diagnosis is key, getting the right medications for the right stage, making those lifestyle tweaks at home, and this seems huge, consistently monitoring that resting breathing rate.
Absolutely. Being tuned in to your dog's normal, noticing those small changes day to day, and keeping up with vet care that's crucial for their health overall, which, raises an important question.
What other subtle things, those daily observations you make about your dog, their energy, their appetite, how they sleep, just their habits? What else could those observations be telling you? Maybe early signs of any health change, not just heart disease. Thinking about that really makes you an even better partner in keeping them healthy and happy.